Hello everyone. Can somebody give me thumbs up for the audio and the video if you can hear me fine or not? Anyone? Am I audible? Am I audible to all of you? Okay, so you all can hear me, right? So in this session, I'll be going over the previous year NEET PG and INICET questions. Okay, so welcome to all of you, and in the beginning also I want to wish you a very good luck and just keep studying hard. First, I'll take the NEET PG 2021 questions of the biochemistry. Myself, Dr. Varsha Gupta, and I welcome you all on behalf of DBMCI. There was this question about the corneal transparency, right? Corneal transparency is decided by who? All these chondroitin sulfate, hyaluronic acid, keratin sulfate, heparin sulfate, or heparin. Sometimes they just may give you the heparin, right? So it is decided by whom? I take options, all of the options one by one, right, so that you know what could be the possible answer for this questions, and also you will be able to know what, if the question is something else, what will be the answer, right, or what will be the questions for the other choices that is given to you, that is B, C and D. Okay, the chondroitin sulfate, right? Chondroitin sulfate is what? It is an unbranched polysaccharide. Right, it is unbranched polysaccharide of variable length, which has what? Glucuronic acid and N-acetyl galactosamine, and it is responsible for what? It is participating in the arthritis. If it is deficient, it gives rise to osteoarthritis in the heart diseases, right? And it is like there are dietary supplements out there in the market usually prescribed with the glucosamine. Okay, so that is chondroitin sulfate. So definitely it is obvious it is not related to the corneal transparency. Choice B is hyaluronic acid, right? What is this? This is an anionic non-sulfated GAG. Why I'm highlighting these? These are very important key terms specific to the hyaluronic acid, right? And they are the chief components where in the extracellular matrix, which is contributing for the self-proliferation and the migration. And where they are found? They are found in the fluids of eyes and the joints, and the function is the cushioning and the lubricants in the joints and the other tissues. Okay, so they are found in the fluids of the eyes and the joints, but their primary major functioning is the cushioning, right? The correct answer is keratin sulfate for this question, that is choice C, which is majorly responsible for maintaining the transparency of the cornea. What it is doing, where it is occurring, it regulates the collagen fibrils organization, okay, and maintain also the corneal hydration, right? If the keratin sulfate is deficient or is not available in abundance, it is going to decrease the hydration of the corneal, right, and also leads to the corneal opacification. Now, there are some of you might think about the chondroitin as an answer to. See, chondroitin and the dermatan sulfate, they enlarge the interfibrillary space. They also affects the collagen. So some of you might think they are primarily responsible for the corneal transparency, but they are not primarily responsible. And that's difference between chondroitin sulfate and dermatan sulfate is what? They are isomers of each other. In the questions further down the lane in this video, I'll show you the structural difference between both of them also, right? So last option D, that is heparin sulfate, right? I'll discuss this also, though this was not the correct choice, but this is what this is usually given as a heparin in the exam, and heparin is a linear polysaccharide, and it is mainly involved in the angiogenesis, blood coagulation, we know that, right? And also it abolishes it is related to the GRAN enzyme, right? GRAN enzyme B, just remember this, right? And it acts as a cellular receptor also. It is a part of a SARS-CoV-2 virus. When the virus is going to attach with the ACE2, right, ACE2 receptor, specifically it plays a role over there also. So that is a link to the SARS-CoV-2 virus. Okay, now there was this question number 2. If you cannot hear me or something, please put something in the chat box. Can you hear me all? Dr. Nasira, Pinacchio, Prashant, Abhay. Can anybody of you give me a thumbs up so that I know you are able to hear me out? Hey Samuel, Bootstrap, Ronak Patel. Okay, you can hear me out. Okay, very good. So another question was this about a 5-year-old male patient presented with the what? Anemia, bone pain, hepatosplenomegaly, right? And the biopsy is you have this picture, right? And of the biopsy, what is the enzyme defect involved in this case? What do we see here? We see what? We see the wrinkled tissue paper appearance indicated by the red arrows, right? And whenever you have the wrinkled tissue appearance, what we know that is related to what? The Gaucher disease, and Gau is glue. So enzyme deficient is glucocerebrosidase, right? And this is what? Autosomal recessive, and it is a lysosomal storage disorder, right? So correct option for this is choice A, that is glucocerebrosidase. So when will the hexosaminidase A will be the correct choice? Hexosaminidase A enzyme is responsible for the Tay-Sachs disorder. If this enzyme is deficient, that is going to give rise to Tay-Sachs disorder, which